Hello and welcome to Veterinary Instrumentation's latest episode of Under the Skin, a videography series introducing key devices used during orthopaedic surgery. In this episode, we will be focusing on tensioning devices, which are sometimes used during extracapsular techniques for treating stifle instability following cruciate rupture. So, let's go under the skin. Achieving the correct tension on the line when performing these procedures is of utmost importance. A tensioning device can help the surgeon achieve this. Lateral suture and lateral button suture are two commonly performed techniques to treat stifle instability following cranial cruciate ligament rupture. Correct tensioning of the extracapsular suture is essential. If the line is not correctly tensioned, stability of the stifle may not be restored, or range of motion may be impeded. Some surgeons will choose to tension the line by hand, but others may choose to use a dedicated device to help them achieve the correct tension. VI supply two dedicated tensioning devices. One is a standalone device, and the other is a paired device for use with a Gelpi retractor. Using the standalone device, the crimp is placed onto the loop in the normal way, leaving long, free ends of line. The jaws of the tension device are placed on either side of the crimp, close to it. The free ends of the line are pulled through the slots in the jaw and crossed over the top of the tensioner in front of the knurled screw. The free ends of line are pulled back so that the two strands pass under the flange of the screw. The screw is then tightened to trap the line. Squeezing the handles of the device will now create tension in the loop. Use of the spin lock will allow for very fine adjustment of the tension. When the desired tension has been achieved, the crimp is crimped in the usual way. Some surgeons may prefer to use the paired device, which is used with a Gelpi retractor. The free ends of the line are passed through the crimp in opposite directions as usual. The tension clamps are threaded onto the free ends of the line so that the knurled portion of each clamp aligns with the crimp on either side. The knurled portion is tightened down onto the line. The tips of a Gelpi retractor are placed through the holes in the body of the tensioning clamps. Distraction of the Gelpis will create tension on the loop. Once the desired tension has been achieved, the crimp is crimped in the usual way. Use of a tensioning device is a matter of surgeon preference. For further information on VI's range of tension devices, please visit our website or contact our specialist technical support team. Join our online community by following our social media pages, keeping up to date with the latest releases of training and education material and company updates.